Okay, welcome everyone. I'm really excited today to have Dr. Jeremy Lamb here with us. He currently practices at Lamb Clinic alongside his sister in Tustin, Orange County. Dr. Jeremy earned his medical degree at Loma Linda University in California. He is board certified in internal medicine. He serves as an assistant professor of medicine at Loma Linda University Health, where he teaches residents and medical students while also providing medical services to the underserved. He focuses on preventative medicine and utilizes both conventional, traditional medicine with functional and integrative approaches to treat the whole person. And I absolutely love this approach, Dr. Jeremy. So let's get straight into it today. Welcome to you.
Great. Thank you for having me here.
Excellent. Now, look, we've learned what adrenal fatigue is, the different stages and the reasons people are getting so exhausted these days from Dr. Carey. So I'd love for you to explain a few things on from that today. And those things will be around why we gain excess belly fat, what happens to our metabolism, plus go over some mistakes we should avoid if we're in the process of regaining our health and energy once again. So you can really pinpoint for us what to avoid if we are wanting to get better energy, but prevent those worst stages of adrenal fatigue. So the first question for you is, why is it that people can have stubborn belly fat and it's hard to budge no matter how much they exercise or how well they eat? And I noticed this myself in going through the fatigue. Why does the belly fat stick to this particular area in this case?
Right. So, actually, stubborn belly fat can actually be caused by a multitude of reasons. The obvious reason, is just there's too much calorie intake to the amount of energy that a person is burning. Now, in those cases, the solution is pretty simple where you just kind of have to cut down your calories. But in most people, in most cases that I see, people come in complaining of, they're dieting, they're exercising, they're watching what goes in and what goes out. And then yet they still find that they're gaining weight. And that's when I start to think about the adrenals and how that's affected. Now, remember that the adrenal fatigue is still not a medical diagnosis because there's no testing that can really truly pinpoint that. But it's really the adrenal fatigue syndrome with a constellation of symptoms that really points to a clinical picture of what the client is trying to tell us. So when they tell us that, they're having this stubborn belly fat, I start to think about the adrenals because really to make cortisol, which is the anti-stress hormone that the adrenals make, the main ingredient you need is fat, right? And
Right.
so when your body encounters stress, your body needs to make much more cortisol to fight off the stress. And so, the synthesis pathway for cortisol starts with cholesterol, which is mainly in your adipose tissue. So when you encounter stress, the cortisol is made, which then go to the glucocorticoid receptors in the body to help respond to stress, right? So your cortisol needs to attach to these receptors to fight the stress. And the main site of these receptors for the cortisol is in your central abdomen region.
Okay.
So the central abdomen is where, you have a lot more cortisol receptors compared to the periphery in your arms and in your legs. And so cortisol goes to your central abdomen region and then it, stores away the fat. And it's doing this because when you encounter stress, you want to kind of hibernate you want your body to kind of get reserve energy. So it's storing away all that fat and it's bringing it all to the central region because that's where the cortisol is attracting the fat.
Right. So
And
that
there's
would
also, go
go
ahead.
ahead, Jeremy.
And so the second reason why really there's two reasons. The first reason is what I said. And then the second reason is also because when cortisol is in high demand, uh, a significant amount of energy is going to make cortisol because your body needs the cortisol.
Right.
And so really your body, in order to make the process more efficient and adapt in a way, the fat and the cholesterol is going to move to the central region in your internal organs and the abdomen region, because that's where cholesterol and cortisol is also made. So in a way,
Interesting.
it's really shifting all the energy into that central region so you're able to handle the stress better.
Interesting. So
Right.
is this an answer that we are getting from you right now to answer that long question that people ask of, how do I get rid of the spare tire around the tummy? Is that kind of hitting on that?
Exactly. Yes, that's exactly hitting on the point. And so a lot of times people ask me what they can do to lose this central region, right? Their belly fat, because it's so stubborn.
Right.
And my response is, and they always ask me, how long is it gonna take when
Mm.
when they ask me first? That's their first question. And my normal response is, it takes a while to get to that point. We have to get down to the root cause of what is causing it and then fix that root cause and everything else will fall into place. So,
Sure.
dieting or intense exercise could actually make that root cause worse instead
Right.
of better. So it's really needs some investigation and further lifestyle changes, not just going around in that circle because, people diet and it's not getting better. They work out and
Wow.
it's actually getting worse. So it could be making
Yes.
their root cause worse.
Exactly, exactly. Yeah, that's why digging into this is so important as well. And the next point that we have on this as well is the thyroid. So this is, you've mentioned this is really important in relation to our energy and adrenal health. And Carrie mentioned yesterday that it can be confused for sometimes people get put on different thyroid medications
Yeah.
mistakenly. But can you explain a little bit about that importance for us?
Yeah, so the thyroid is actually very important in relation to adrenal health. Now, a lot of people have hypothyroidism, some people have Hashimoto's, and it's kind of just this phenomenon where a lot of people are getting put on thyroid medication to kind of boost their metabolism, to boost their energy. We're seeing that a lot of the reference ranges of these thyroid labs are kind of shrinking, so then more people are falling outside the range of normal for their thyroid function. Now, when your body encounters stress, like I had said before,
Mm.
your body really wants to hunker down and only put on the organs that are really functional
Right.
to survival, right? And so the most effective way to conserve energy is to kind of also decrease thyroid function. So low thyroid gland function is normal when you encounter stress. But when stress is chronic, that's when things kind of get dysregulated. Okay. So actually, when you encounter stress, it's not necessarily that your thyroid gland is not functioning properly. It's just doing its job and decreasing its energy output, right? And so you kind of the adrenals are telling the thyroid to, hey, slow down, and so that subclinical state of hypothyroidism occurs. And so what actually happens, and some of the physiology, I'll just go into it a little bit, is we all know about the T4 and T3 hormones.
Sure.
And so when your thyroid encounters stress, you have decreased production of T4 and T3. And then also the thyroid is saying, hey, we need to increase our thyroid binding globulin because we need to grab onto more of these thyroid hormones to save for later. And so when your thyroid binding globulin increases, you have less free thyroid hormone circulating around your body as well.
Does this then contribute towards that feeling of tiredness that people often feel?
Yeah, it could possibly. And because your thyroid hormone is needed to increase your metabolism and increase
Uh,
your energy, really,
So then does
right?
that have an effect on the metabolism and our ability to process fat and remain at a healthy weight?
Yes, yes. So again, when your thyroid decreases, then your metabolism is going to slow down. And so everything is going to be basically slowed and is going to be focused on survival
Right.
rather than losing weight. You want to be putting on and saving that weight to kind of encounter the stress,
Yeah,
right?
that makes a lot of sense actually. And I can see
Yeah.
how it's now starting to really relate into every other aspect here. And you mentioned as well before we got on here that the ovarian system is actually a massive part of this whole process and cycle. And it's really, really important for, again, once again, our energy, tiredness, and this adrenal health. So tell us about the ovarian system and that part of it, the equation here.
Well, there's something called the ovarian adrenal thyroid axis, okay, where, these three systems are very closely related. And so I like the example where, if you have a three-legged stool and one of the legs are not functioning well, you're not going to be balanced. And so the same thing applies to the ovarian, the adrenal, and the thyroid. and in males it's the gonads really instead of the ovaries. You
Mm.
know, if one of these three organs are not functioning properly, then you're not going to be optimized. Okay, so actually I want to go back quickly to the thyroid because there's quite similar symptoms that a lot of people come in saying that, oh, I have hypothyroidism or do I have adrenal fatigue, and
Right.
because they're actually quite common in how the symptoms kind of cross relate. And a lot of people actually find themselves having to need to be on thyroid replacement.
Hmm.
And so, because the similarities are so similar, the adrenal fatigue actually tends to get missed. And, people who actually find themselves getting diagnosed with hypothyroidism, especially after a traumatic or stressful event, because remember, we had talked about the stress,
Right.
such as, if they're pregnant, if they had an accident, if they had emotional trauma or things like
Yes.
that, should be on alert that there could be an underlying issue going on, especially if thyroid replacement is not helping. And a
Sure.
lot of our clients, they find that, they're on the thyroid replacement and then their energy only boosts for a little bit
Mm.
and then it goes back down. And then their dosing goes up and then they get a little boost and then it goes back down. And that's because, the thyroid medication is doing the right job in optimizing the thyroid gland, but
Yes.
then you're pouring oil on a fire, right? Because you're not
Sure.
addressing the underlying weak adrenal system.
That's really
And so
interesting
often,
point.
yeah,
Sorry
right,
but to cut you off. It's really fascinating because at the very start, your whole introduction here is that you treat the whole person, and this is exactly it, right? It's
right,
looking at other factors here that are contributing to this, not just looking at that one aspect. And I
right.
know I've had clients before who have come in to see me when I was working in the gyms and doing fitness stuff, and they were on medication like that, but they were still really tired, and the weight wasn't budging, and all these other
Right,
things are still not ticking off the box to look at
right,
their
right,
to get to their overall goals. So this makes a lot of sense.
right. And so actually, I found a lot of times that when we do work on the adrenal fatigue and kind of work on that, sometimes people are able to come down on their thyroid replacement dosing, or even sometimes come off of it with their
Yeah,
guidance of their doctor here. And so,
nice.
is the key is resolution of the adrenal function and getting to that cause. And sometimes the thyroid itself kind of just normalizes.
Yeah, yeah, that makes absolute sense. Can you tell us
Right,
then the mistakes that we've kind of got onto this now, the mistakes that people make when they're trying to heal from either this state, say, first part of lack of energy or burnout, and then again to adrenal fatigue. So if someone's watching this right now and they're like, you know what, I've been really tired. I've been tired for a long time. I get up, I sleep well, but I still get up tired. Or I don't sleep well and I still get up tired. Either way, there's this thing just kind of starting to overcome them with their energy and they can't function as well. I actually had recently a message from a friend, and she said she's feeling like she's a quarter of the person she normally is
mm,
at the moment. There's this
mm-hmm,
horrible,
mm-hmm.
overwhelming feeling of tiredness. So tell us what the mistakes people do at that point, and then the mistakes they make if they definitely have adrenal fatigue.
Right. So I think there's, like you said, I don't know if your friend has had a thorough workup because that's always needed, routine blood labs to just make sure that the big things are not missed, and then after that, I don't know if she's had her hormones tested. A lot of people, especially women in menopausal range, they need to get their hormones tested to see if there's hormone deficiency. And
Mm,
then at that point is also whether, even if they were diagnosed with hormone deficiency, whether there's an underlying adrenal issue or not.
right.
So really needing to get on that aspect. A lot of times through conventional medicine standpoint too, they go through the proper workup and they're only placed on really band-aids. If
Right.
you are feeling low mood or depressed, you'll get put on an
Mm,
antidepressant to help with the symptoms.
mhm.
Maybe if you're having palpitations, you go see a cardiologist and you're put on like a beta blocker or something that just
Right.
slow your heart rate. So really the thing I always get down to again is trying to get down to the root cause, because
Mm,
everything, and a lot of people make this mistake where they just patch their symptoms and
sure.
kind of put band-aids on. And that's only going to work for so long because you still have the underlying cause that's not being addressed.
Exactly. And then, for instance, I mean, I know people as well, and even myself back when I was feeling these things a few years ago, the thing to do is if you're tired is you go and then maybe get some energy drinks or
Right, right,
increase your coffee, your
right.
caffeine intake and some coffees,
Yeah,
and then start to go, oh, okay, I'm really getting that 3 p.m., that decrease in my energy in the afternoon. I'm going to go for the lollies or the chocolate or some sugar and caffeine. And that's where things, I would imagine, start to compile
right,
really
right.
badly on the body if you're already
Yeah.
at that kind of point of stress. And that's where it can become a worse condition. Is that right?
Yeah, that's exactly right. And we've all kind of been through that, right?
Right.
And I think it also gets into that mindset of we're telling ourselves, okay, this is normal. Everyone needs coffee. In
Yes.
our society nowadays, coffee is, a good thing, sort of, quote
Mm,
unquote. But that's not necessarily true. And we need to retrain our minds that, hey, why am I feeling fatigued? This is not
mm,
normal. It's
mm,
not normal for my age. A lot of people just blame it on aging, but there's plenty of
mm.
60, 70-year-olds who are at the peak of their health and feeling even better when they were in their younger age,
Sure, sure.
right? And then some other, common mistakes that I see that adrenal fatigue sufferers make is, oftentimes we don't change our diet. So,
Mm,
we're human beings and we want the quick fix. And the quick
yes.
fix in a lot of people's mind is just, hey, I'm just going to take some supplements and kind of see if that helps. But
Mm,
even if the supplements are not the best quality, I mean, if they are the best quality, no matter if you're not changing what goes into your body,
mm,
then really, supplements can't counteract the negative effects of a diet. And not only
yes.
that, it's also changing the lifestyles,
Yes.
because if you're a go, go, go type A person, and no matter how much we work on that, if you're not changing your lifestyle, we only can really support your adrenals so
Yeah.
much.
Can I tell you a quick story here, Jeremy? You
Yeah,
just reminded me. I had a client years ago, and she had, guess how many cups of coffee a day?
four.
14.
14. That's 1 hour almost.
Right, because she was a night shift worker. It
Oh,
was
my.
it was fascinating, and this is years ago before I knew anything about adrenal fatigue or even had it myself. This is even back then, and
Right.
but in my head I was thinking, surely this isn't good on any level, right? And then interestingly, her weight, she was quite fit, but her weight wouldn't ever shift. And I said to her,
Mm.
you got to pull back on the coffees, like you know,
Yeah.
14. Can we try 10 today instead of 14? Like that'd be an improvement,
Right,
right?
right, right.
Oh my gosh. So that was clearly affecting everything you've mentioned with the thyroid, the ovarian system, and this energy to the cortisol belly fat, right?
Right,
Because
right.
her body was overloaded and overstimulated.
Yeah, exactly. How much coffee did you get her down to?
I think
Were you
three
able
or
to?
four. I think
Wow.
3 or 4 after a few months. And then I tried to substitute in green tea or something. I'm like, well, at least that
Yeah.
has a little less caffeine.
Yeah.
Or like tea, can we pretend it's coffee, right?
Right, right,
Anyway,
right.
that was interesting. But yeah, back
Right.
then you kind of go, gosh, if you're not sleeping, and you're right with the lifestyle, it is so integral. And I think something that a lot of us struggle with, changing lifestyle and habits, because we're all in our habits, right? So
Right.
how do people, what's the first thing they need to do to kind of overhaul their lifestyle? Like, you don't have to go through the full plan right now, but let's say a couple of things that you could do just to start changing things a bit. Like, what, go to bed earlier, or what do you think?
So I think there's a couple components that are key to adrenal fatigue recovery. One of them is, again, like I said, the diet. And so diets are there's a lot of diets out there. But I think the main principles regarding all the diet is that you need to have a balance of proper nutrients. And especially in adrenal fatigue, you need a balance of both protein, fats, carbohydrates, and the vegetables that you also intake. And ultimately, is also decreasing the amount of inflammatory foods that go
Right.
into your body. So the key is, sugar, alcohol, caffeine, and then other inflammatory foods that could be making your system more stressed. So is
Yeah,
controlling that stress that's coming in.
that's a
The
great
other,
tip.
yeah.
And as
The
well,
oh, go ahead.
Sorry, this is so good. I've got so many questions for you. In terms of the supplements, I'd like to touch on that. You went to that a few seconds ago. Give us like 2 supplements that might be good for this, for better energy,
Yeah.
in your opinion.
So I want to preface this by saying, because a common mistake that I see people in dealing with adrenal fatigue and self-navigating themselves is that
Mhm.
there is improper use of nutritional supplements. And oftentimes people just take a shotgun approach
Mm.
and take a cocktail of supplements. We've all seen those people where they have 20, 30 bottles of supplements and then they don't even know what they're taking it for, why they're taking it for. Oftentimes this kind of backfires and people
Wow.
feel worse. And then sometimes even if you do feel better, you don't know what is helping, right? Because you're taking all these. So really, supplements need to be kind of approached individualized, have an individual program, because not all supplements are needed for each person. And kind
Okay.
of that's what we actually do at Dr. Lam Coaching, is kind of
Right.
have a personalized approach. We talk to you because the dosing changes. Some people need half dosing, some people need twice the normal. And then also the delivery systems are kind of unique as well, and when to take each supplement, because there's supplements that can stimulate your body, some that calm your body, some that help with
Mhm.
sleep. And so it's really individualized approach that you need for supplementation,
Yeah, that's a good point.
right?
Yeah,
And
yeah,
then,
and
like you
that's
said, supplements to help with the adrenals.
yeah,
I also see a lot of people who takes herbs, adaptogens, and
yes.
glandulas, and these can work for some people who are not sensitive and work in the beginning. But if your fatigue is pretty bad, and these supplements and herbs and could actually backfire and make the adrenal fatigue worse, and we see that a lot, especially
Really?
because we deal with the deep end cases where
Sure.
they're in the severe stages of adrenals, and it can actually crash the patient if you're not too careful. And like I said,
Interesting.
these herbs and the adaptogens and glandulas, that's also in itself just a band-aid, even though it's still
Mm.
good supplements. When you're not really giving the proper nutrition, not doing the proper supplementation, and changing the lifestyles
Yeah.
on how to address the adrenals. Now, the
So,
one
yeah.
supplement that we actually, I know I'm talking a lot, sorry.
No, go ahead. I love hearing
uh,
this. I hope everyone
yeah,
else does too.
so over at Dr. Lam Coaching, we developed our own line of supplements because we've been dealing with adrenal fatigue for over 10 years, and we've kind of come to really know what the body needs. And the one supplement that we often use is vitamin C. Okay, because
Mhm.
vitamin C, the amount of vitamin C in our body, the most is in the adrenals. And so most people with adrenal fatigue are actually vitamin C deficient. Now, there's actually different forms of vitamin C. We all have liquid, we have powder, we have ascorbic acid, ascorbyl palmitate, magnesium, things like that. So we work with different types because they get absorbed at different rates. They get affect different parts of the body. And so some people are gonna be feeling better on the ascorbic acid, but then they feel worse on ascorbyl palmitate. And so it kind of takes that individualized approach that I said again. And
Wow.
something that we've actually found that's really great is, I don't know if you heard of liposomal technology before.
No. What's
So,
that?
liposomal technology is where you put the supplement inside this phospholipid fat capsule. And so it gets absorbed into the intestine better, and then also gets absorbed into the cells and brings the nutrients into the cells. So we have our own version of that liponano C where, because vitamin C is water soluble, so it's not going to be absorbed as well. So you need to kind of put it inside this fat capsule so then it gets absorbed better into your system.
That is
So that's good.
fascinating.
Yeah. So vitamin C is actually very important in our one of our key to helping the adrenals kind of recover.
That's interesting you said that because the one thing that when I got diagnosed here in Sydney years ago by the doctor who actually picked up on this was he
Yeah.
put me on vitamin C, a particular type. The
Uh-huh.
first,
And
the
how did you
first thing,
feel with
the
it?
first thing he said, I was also then put on different vitamin infusions and so forth, but that's another
Yeah.
story.
Yeah.
Yeah, I noticed probably that my immune system got better because I was getting sick really frequently, like just head colds and things all the time.
Right. Right. Yeah.
And that was really odd because I was a so-called, fit personal trainer. So the vitamin C was integral, I think, in
Right.
helping rebuild my immune system And I'm sure it does many, many other things as well, of course, but
Yes, yes,
that
yeah.
was probably part of it. Yeah, just interesting.
Right,
You said that
right.
as the first thing that you would recommend.
And I think that's the key thing that is also important is and the common mistake is also that people only think, and I know we've talked a lot about the adrenals and the hormones today,
Mm,
but there's really your whole body to look at. So there's
right.
the hormone circuit that we've already addressed a lot today, but like you just mentioned, the immune system needs to be working properly. If the immune system is not, then the rest of your stress response is still not going to be. Your detox pathways, including your liver, your extracellular
Mm,
matrix, your microbiome with your gut, that affects not only your immune system, but also your neural system because a majority of the neurotransmitters are made in the gut as well. So I think we do focus on the adrenals, but it's important to keep in mind just the whole body and the
yeah,
different organs that are involved to really address that. So
yeah.
adrenals are still important, but you know your cardiovascular system, again, like all the other things I mentioned, are important to kind of get your whole body back on track.
Yeah, absolutely. And I love how you keep reiterating that we all need to bring it back to this overall perspective and shift in our lifestyle, the eating, the sleep, the exercise. We're going to talk about that on another session as well. And also even mindset, habits, lifestyle, the correct supplements, the correct coaching and so forth. And I think addressing where you're at different points and understanding if you're here, if you're just a bit tired, try not to go grabbing for the coffees and increasing that because that'll push you over the line to get worse. Was
Exactly.
there
Yeah.
any other mistakes that you see people make that you could perhaps help our listeners with today, or some other tips with this?
Yeah, you know, I know you had mentioned a little bit about you're going to be talking about the exercise in a little bit as well. Oftentimes, people in adrenal fatigue, they want to exercise because, you know, exercise is good,
Yes.
but it has to be at the right time and the right intensity. And so I find it in the beginning, especially in severe cases of adrenal fatigue, that it's kind of just we have to put exercise on the back burner while your body stabilizes. The
Yes.
more adrenaline that's going on in your body is going to make the stress worse.
Yeah.
So, you know, people are finding that they're exercising and they're crashing after, if they're feeling super fatigued, and that's too much exercise. And that's your body's way of telling you that, hey, you need to cut back, you need to calm down. I'm not liking this, right?
Yeah.
And so ultimately is really, again, that's what we teach our clients, and they tend to do much better is listening to what your body is telling you,
Yes.
because our bodies are telling us things that are going on inside, and that's kind of what is lost in medicine today is, you know, we rely on our tests, on our imaging, on things like that, but really the symptoms tell a story, and that's why it's so important to get a good history.
Mm,
And then really your body is telling you things for a reason. It's not just saying, hey, this is I'm feeling fatigued, but why is your body feeling fatigued? Why are you getting body aches? Why are you getting brain fog? And it's
mm.
investigating those whys and listening to the body. That's what is really the key thing.
Yeah, that's a fantastic tip. I love that as well. And I noticed even and I don't want to keep talking about myself, but I think it's a good example because I have gone through it all. And in terms of the fitness stuff, like I had to go from teaching 10 to 15 pump boxing circuit
Mm,
classes a week at a gym to that doctor saying to me, you got to stop all of this. And I was like, what? This is what I do. This is what I know
yeah, yeah,
for the last 10 years. And so
yeah,
I had to stop and then be open enough to go, I'm going to learn Pilates, I'm going to learn yoga, I'm going to
right.
learn meditation, and I'm going to learn some Tai Chi. So that's
Yeah,
kind of like
yeah,
what I had to do. But that mindset block as well is sometimes it comes into play. I've seen a lot of people come to me then obviously knowing I've gone through that, but then they're like, no, but I have to do the boxing because I've got belly fat. Like, but
right,
no, but
right,
if you're so exhausted, this will only cause you more damage. So
exactly.
I'm so
Yeah.
glad that you guys like look at all of these things as well to really help people. This has been such an insightful interview, Jeremy. I really would love to do another one with you soon. Finally, I would love one more tip to help people stop mental fatigue day to day. What's one thing we can do? Like, do you believe in um, perhaps meditation, or do you believe people should write down their goals for the day to not get overwhelmed? What's a little kind of trick that you would advise people just for healthy maintenance?
So, a meditation is definitely a good one that I recommend to people. Taking some meditation to kind of really reset your mind, because throughout the day, different things are really hitting us. Another thing that I find, and actually I do, is, just gratitude journals to kind of make sure that your mind is set right. Because in today's world, there's so much negativity out there that we have to reset our mind and kind of be putting out positive thoughts into our mind and things that we're thankful for. Another thing that's really great that I found and we recommend to a lot of people is adrenal breathing. And I won't go into that, but you can kind of go on our website and learn more about the way that we breathe can actually change our physiologic response and according to how you approach stress and how you deal with stress, along with the parasympathetic and sympathetic nervous system. So the adrenal breathing is really, really important that we recommend for people.
Great. Well, that's some awesome tips to finish up. Thank you again for your time. It's been amazing having you. And everyone, I hope that you've loved this interview as well. It's been absolutely phenomenal. So much knowledge. If you want to get in touch with Dr. Jeremy or his team, go to drlambcoaching.com. There's a phone number on there as well. If you would like to reach out, just dial in your country code if you're from outside the US. And they've also got lots of really helpful tutorials, blogs, and starter kits on their website as well. So head to them, get a free consultation as well if you would like to. And thanks again, Dr. Jeremy.